Hi, Michelle Glass here. Welcome to our first episode in our Chapter 9, Lecture 9 video series. We are just going to be learning a small portion out of the Chapter 9, so we're not doing the entire chapter here. We have been talking about osteology in lecture, and you have been studying the skeleton in lab. And so our job here in this chapter is to start looking at how those bones are connected together. So we're looking at what are called articulations or joints. So let's get started. Your joints are going to be categorized based on two classifications. The first is listed here, your structural or anatomical classification. So we have bony joints, which are pretty straightforward, bone connected to bone. Fibrous joints, think here of ligaments connecting the bones together. Cartilaginous joints are connected by either hyaline or fibrocartilage, and then synovial joints are the most complicated in the anatomical classifications. We'll have an entire video just dedicated to the synovial joint, so more later. Our second category is the functional or physiological classification. So here we're looking at how much movement we see at each one of our joints. And Synarthrosis joint is one without any movement. Amphiarthrosis is somewhat movable, and diarthrosis can be described as freely movable or allowing for the most movement. Now, just because it's freely movable or the most movable joint doesn't mean there are no limitations. So as we start looking at specific joints, we'll see how they can be limited in their type of movement depending on the bone surface attachment and how the ligaments and muscles and so forth are connected. Now notice each of our functional classification terms ends in arthrosis, and this is a ending here that just means joint. You've probably heard before of arthritis, and you know that is swelling of joints, and so that's how we're getting that nomenclature there. Now it's important to note that the synovial and the diarthrosis joints are going to be the same joints. Okay, the difference here is, again, the term synovial is referring to the anatomical structures, while the term diarthrosis is instead referring to how much movement we're going to see. All right, now even though we have these two different classifications of joints, we'll see that all of the joints in the body can be identified as one of 12 types of joints, and each one of those 12 is assigned a name, and also it's assigned both a structural and a functional classification. So our job next is to look at these 12 types of joints and see how they're classified and be able to give examples in the body. I'm going to give you your 12 types in blue, and then you can see that we're starting with the synarthrosis joint, so that's here in pink, and then the anatomical classification is going to be shown in green. So the first example to look at is the synarthrosis. A synarthrosis is a bony joint. So if you have bone fused with bone, then clearly there's no movement that's happening there. The best example here is the epiphyseal line, which is what's showing up after epiphyseal closure has occurred. So we looked at in a growing long bone, you're going to keep some of that epiphyseal cartilage, but as that bone finishes up, it's going to turn into bone, and so you're left with that epiphyseal line. A suture is a fibrous joint, so we're looking here at connective tissues, ligament types of tissues, connecting the bone to bone. You saw that there are lots of different sutures when you were looking at the skulls in lab. You've named 4, so you should recognize coronal, sagittal, lambdoid, and squammal sutures as examples. The gomphosis is a fibrous joint between the teeth and either the mandible or the maxilla. So it's anchoring the teeth into the bones of your jaw. Now, teeth are not actually bone. You're going to be studying the anatomy of teeth when you study the digestive system next semester. But we're still going to talk about it here as a joint. Now, clearly, we're not expecting our teeth to be movable in the bone of our jaw, and so this is another example of a synarthrosis. And the last is called a synchondrosis, and chondro here means cartilage. So a synchondrosis joint is a cartilaginous joint that allows for no movement. So the epiphyseal cartilage that you have in the growing long bone between the diaphysis and the epiphysis would be an example of a synchondrosis. And then also between ribs 1 and 2 and the manubrium, so remember that's the top portion of your sternum. Okay, moving on to the somewhat movable joints, the amphiarthrosis joints. The first one to label here is the syndesmosis. Now this is a fibrous joint, so remember, think of ligaments. You have a ligament at the distal end, so that's going to be the wrist end, between the ulna and the radius, or the ankle end, the distal end, between the tibia and the fibula. So we have some movement that can happen between those bones, but not a whole lot. Symphysis is something that you've named as part of your lab work. You should have named the pubic symphysis, which remember is that pad of fibrocartilage in between the pubic bones. That is our definition of a symphysis joint, a pad of fibrocartilage. And so not only do we see the pubic symphysis as an example here, but also the intervertebral disc. Okay, looking at this diagram here, we're seeing that in the top corner there, we have all of our synarthrosis joints, and then in the bottom corner, we have our amphiarthrosis joints. And then I've grouped them together based on their structural classification. So you can see we only have one example of a bony joint, which is Synarthrosis, and it looks like I've left off an N there. It's Synarthrosis, Synarthrosis, and so that's clearly a synarthritic joint. And then we have 3 different types of fibrous joints. 2 of them are synarthrosis, the suture in the gomphosis, and then one of those, the syndesmosis, is amphiarthrosis, somewhat movable. And then we have 2 types of cartilaginous joints. We have synchondrosis, which is a synarthrosis joint, and then the symphysis joint, which is amphiarthrosis. Pretty much it's just a matter here of doing your memorization. So you can use your flashcards for that. You can check out the Quizlet set. I've linked to that in your playlist. Or, you know, you can make a listing of your terms and practice putting it together in a table format or in a matching game or something like that. When we're talking about the synarthrosis and amphiarthrosis joints, these are mostly going to be found in the axial skeleton. The axial skeleton, remember, is the skull and the vertebral column, and you know, that's pretty much it. When we talk about the synarthrosis and, when we talk about the diarthrosis and our synovial joints, we're going to see these mostly in the appendicular skeleton, which are our appendages, and all of those bones that attach our appendages to the axial skeleton. The diarthrosis, remember, is our freely movable or most of movement type of joint, and so it does make sense that we need this to be primarily in the appendicular skeleton. Okay, if I remember correctly, we're going to be listing 6 types of synovial joints, and I'm going to start out with those that are allowing for the least amount of movement and working our way up to those that allow for the most amount of movement. The first one on our list then is the plane joint, or it can also be described as gliding. Our textbook currently says plane. The definition of a plane joint is that it slides in one plane, so it's gliding in one direction. This includes the joint between the clavicle and the manubrium, the sacroiliac joint, intercarpal, so that means in between your carpal bones, and the vertebrocostal joint, so that's the vertebrae and the ribs. Costal is rib. Next, let's look at the hinge. Now, by definition, the hinge joint opens and closes in just one direction. So we're going to see the hinge joint as the elbow, the knee. These are the most readily identifiable, also ankle, and interphalangeal. So, you know, you can bend your fingers in towards your hand, but you can't really take it back in the opposite direction. Same for your toes. Okay, the next is called the condylar or ellipsoidal. Our textbook does say condylar, so that's what we need to be learning. This includes the radiocarpal, so that's between the radius and the carpal bones, the metacarpophalangeal, the metatarsal phalangeal. So metacarpal would be bones of the palm of the hand, and then the phalangeal would be your fingers. And same for your feet, but your toes there. The saddle is next, and this is between the first carpo-metacarpal joint, first carpo-metacarpal joint, and then the pivot, which is allowing for rotation, so we're doing more movement here. This includes the atlas and the axis, the joint between them. So this is what's allowing you to look over your left shoulder or to look over your right shoulder. And then finally, we have the ball and socket joint. This includes the shoulder and the hip. This is the joint that allows for the most range of motion. So when we talk about something being freely movable, that's what we really are thinking about as the most amount of movement that's allowed, and that's between the shoulder and the hip joint. Okay, and that's it for now. Stay tuned for more.